Assalamu alaikum wa rahmatullahi wa barakatuh. My name is 𝐁𝐈𝐿 bin Hussein. I'm the country director for the World Bank in Pakistan. I'm very happy today to visit the Benazir Income Support Program One-Stop Shop Center in Islamabad, joined with the Managing Director of the World Bank, Mrs. Anab Jerde. It's an important visit for us because we've been supporting BISP since the start, since 2008. And we are witnessing the progress that has been made, the new programs, وسيلة تعليم, نشنوما, for education, for health and nutrition, and of course كفالة, the unconditional cash transfer program. And we're very happy with the evolution of the program in terms of the information system, the payment systems, the National Social Registry, also the linkages with the provincial programs and different programs in terms of accessing the National Registry. And we can see firsthand by meeting beneficiaries to understand the constraints, to understand the benefits of the program. And the World Bank, with its new country partnership framework over the coming decade, is committed to continue to support the social protection and poverty alleviation agenda in Pakistan. Thank you very much.
Assalamu alaikum. My name is Ellen Tom. I am the Deputy Representative in the World Health Organization, Pakistan. We have been working with the BISP when it comes to malnutrition management. As you know, in Pakistan, stunting is at 40% and wasting is at 17%. We come in to provide treatment for severely acute malnourished children with complications. Once they develop complications, then we work with the Minister of Health at provincial level in the various provinces to provide admission and treatment to these children in nutrition stabilization centers. Currently with this, we have 143 nutrition stabilization centers across the country where we are treating severely acute malnourished children under 2 and under 5 to ensure that they thrive and they are able to achieve their milestones. So far, since the last quarter of 2024, we have been able to treat 25,000 severe acute malnourished children in the 143 nutrition stabilization centers across the country. We have also been able to provide counseling for maternal and infant young children nutrition to about 38,000 mothers who provide care to the severe acute malnourished children in the nutrition stabilization centers. This is a very timely intervention because we are saving lives of children who otherwise would have lost their lives if this intervention could not have happened. Apart from that, we are also conducting sentinel surveillance, where we are monitoring trends of malnutrition in the various provinces. We thank BISP for partnering with us for the component of treatment of some children with complications. Thank you so much.